Hey everyone, and welcome back. After my recent video discussing vitamin D, I got a bunch of really thoughtful questions about another important vitamin, vitamin K. It seems like a lot of you are curious about its role, especially in relation to bone health. So today, I'm going to tackle those questions head on. We'll explore whether we need to pair vitamin K with vitamin D for stronger bones. What exactly vitamin K does in our bodies? What kinds of foods are good sources of it? And we'll even clear up a common confusion. Is vitamin K the same thing as potassium? So, let's get right into it and talk all about vitamin K today. Before we get started, just a quick but important reminder. The information I'm sharing in this video is for educational purposes only. It's not intended to be a substitute for professional medical advice. If you have any specific health concerns or questions about your vitamin levels or supplementation, please reach out to your doctor for a proper diagnosis and a personalized treatment plan that's right for you. And in case of a medical emergency, please don't hesitate to go to your nearest emergency department or call for an ambulance. Your health is always the top priority. To start, let's just briefly touch on what vitamins actually are. They're organic substances, meaning they contain carbon, and they are absolutely essential for our bodies to function properly. We typically get them from the food we eat. Vitamins are broadly categorized into two groups: those that dissolve in water, like the B vitamins and vitamin C, and those that are fat-soluble, meaning they need fat to be absorbed by our bodies. The fat-soluble vitamins are A, D, E, and K, easy to remember with the acronym ADKA. These fat-soluble vitamins can be stored in the body's fat tissues for later use. Interestingly, while vitamin K is fat-soluble and can be stored, the amount our bodies can store is relatively small, and it can actually be depleted within about 24 hours if we don't have a regular dietary intake. This highlights the importance of getting enough vitamin K through our diet on a consistent basis. Thankfully, if we eat a well-balanced diet, we generally don't need to worry too much about developing a vitamin K deficiency. The recommended daily intake of vitamin K for adult men is around 120 micrograms, and for adult women, it's about 90 micrograms. These are relatively small amounts, and as we'll see, many common foods contain more than enough to meet these needs. There are two primary forms of vitamin K that are important for human health: vitamin K1 and vitamin K2. Vitamin K1 is also known as menaquinone. This is the most common type of vitamin K that we consume through our diet, and it's abundant in green leafy vegetables like spinach, kale, collard greens, and broccoli. It's also found in some plant oils, such as soybean oil and canola oil. Vitamin K2, on the other hand, is a group of compounds called menaquinones. Unlike K1, some K2 can be produced by the bacteria that live in our gut. However, the amount produced in the gut might not always be sufficient to meet all of our needs. Vitamin K2 is also found in certain foods, particularly fermented foods like natto, which is a traditional Japanese dish made from fermented soybeans and is a very rich source of a specific form of K2 called menaquinone 7, MK7. Other animal-based foods like meat, cheese, especially hard and fermented cheeses, eggs, and particularly egg yolks, also contain various forms of vitamin K2. Vitamin K plays several vital roles in our bodies, with two of the most well-known being blood clotting and bone health. First, vitamin K is absolutely essential for the formation of blood clots. Blood clots are the body's natural way of stopping bleeding when we get injured. Without sufficient vitamin K, our blood wouldn't be able to clot properly, and even a minor cut could potentially lead to a life-threatening hemorrhage. Vitamin K acts as a cofactor for enzymes that are involved in the synthesis of several clotting factors in the liver. These clotting factors are proteins in our blood that work together in a cascade to form a stable blood clot and stop the bleeding. Second, vitamin K also plays a significant role in maintaining the calcium in our bones, which is crucial for preventing osteoporosis. weak, and brittle bones, and reducing the risk of fragility fractures, especially as we age. Vitamin K helps to activate certain proteins in the body, such as osteocalcin and matrix Glay protein, which are involved in binding calcium to the bone matrix and regulating calcium deposits in the body. Osteocalcin, for example, is a protein produced by bone-forming cells, osteoblasts, and it needs vitamin K to function properly in incorporating calcium into the bone tissue, contributing to bone strength and density. Matrix Glay protein helps to prevent calcium from being deposited in soft tissues where it doesn't belong, like in blood vessels. There have been some observational studies that have suggested a link between diets low in vitamin K and lower bone mineral density, as well as a higher risk of hip fractures, particularly in older adults. This has led to a lot of interest in the potential role of vitamin K supplementation for bone health. The good news is that it's generally quite easy to obtain an adequate daily intake of vitamin K through a balanced diet. As I mentioned, green leafy vegetables are excellent sources of vitamin K1. Just to give you some examples, 1 cup of cooked collard greens can provide a staggering amount, often over 1,000 micrograms of vitamin K1. Similarly, 1 cup of raw spinach contains around 890 micrograms. Even vegetables like broccoli, around 220 micrograms per cup cooked, and Brussels sprouts, around 218 micrograms per cup cooked, are good sources. And let's not forget about other common greens like lettuce and cabbage, which also contribute to our vitamin K intake. For vitamin K2, natto is a particularly rich source, containing upwards of 1,000 micrograms per 3.5-ounce serving. You can also find vitamin K2 in smaller amounts in foods like pork sausages, soft cheeses, and egg yolks. So, as you can see, incorporating a variety of these foods into your regular diet can easily help you meet the recommended daily intake of vitamin K. There are a few specific situations or medical conditions where a person might have difficulty absorbing vitamin K properly due to malabsorption issues. This can occur in people who have problems absorbing fats in general, such as those with liver disease, gallbladder problems, or biliary diseases, conditions affecting the bile ducts. Since vitamin K is a fat-soluble vitamin, it needs fat to be absorbed from the digestive tract. Additionally, individuals with certain gastrointestinal conditions like celiac disease and cystic fibrosis can also experience impaired fat absorption, which can lead to lower levels of fat-soluble vitamins, including vitamin K. In these cases, doctors might need to monitor vitamin K levels and potentially recommend supplementation to ensure adequate intake. It's also important to mention a medication called Coumadin, Warfarin, which is a commonly prescribed blood thinner. Coumadin works by inhibiting the action of vitamin K in the body, thereby reducing the formation of blood clots. It's used in people who have a higher risk of developing blood clots, such as those with a history of stroke or certain types of heart disease. For individuals taking Coumadin, maintaining a consistent intake of vitamin K through their diet is crucial. Large fluctuations in vitamin K intake can interfere with the effectiveness of the medication and make it harder to regulate their blood clotting time. Therefore, people on Coumadin need to have a stable dietary intake of vitamin K and should always consult with their doctor before making significant changes to their diet or taking any vitamin K supplements, as these could potentially interact with their medication. The question of whether we need to supplement with vitamin K, especially alongside vitamin D, to improve bone health, has been the subject of several research studies. One notable example is a large randomized controlled trial conducted here in Ontario by some of my colleagues at the University of Toronto. This study involved 440 postmenopausal women who had osteopenia, lower than normal bone density, a precursor to osteoporosis. The women were randomly assigned to receive either a high dose of vitamin K1, 5,000 micrograms, or a placebo daily for 2 to 4 years. All the women in the study also received calcium and vitamin D supplements, aiming for a total daily intake, from diet and supplements combined, of around 1,500 milligrams of calcium and 800 international units of vitamin D. Interestingly, the researchers found that the high-dose vitamin K1 supplementation did not provide any significant protection against age-related decline in bone mineral density at key sites, like the lumbar spine, total hip, femoral neck, or wrists. However, the researchers did suggest that there might be a possibility that vitamin K supplementation could offer some protection against fractures and certain types of cancers in postmenopausal women with osteopenia, but they emphasized that more research was needed to confirm these potential benefits. The challenge is that there have been other studies with smaller sample sizes looking at vitamin K supplementation and bone health, and their results have often been conflicting. Some have shown modest benefits, while others have not found any significant effects on bone density or fracture risk. So, the main message here is that vitamin K is indeed essential for our health, primarily for its critical role in blood clotting and its contribution to maintaining healthy bones. It's generally quite easy to obtain an adequate amount of vitamin K simply by eating a balanced diet that includes plenty of green leafy vegetables. While vitamin K supplementation doesn't appear to have any serious side effects for most people, the current evidence doesn't strongly support the need for routine supplementation in healthy individuals for bone health, especially if they are already getting enough vitamin K through their diet. However, as always, it's a good idea to discuss any questions or concerns you have about your vitamin intake with your doctor. And as I mentioned earlier, individuals who are taking blood-thinning medications, like Coumadin, absolutely need to speak with their doctor before taking any vitamin K supplements due to the potential for interaction. And finally, let's address a common question. No, vitamin K is not the same thing as potassium. Vitamin K is an organic chemical substance, a fat-soluble vitamin that plays a role in blood clotting and bone health. Potassium, on the other hand, is a mineral element. It belongs to Group 1, the alkaline metals, on the periodic table, and is represented by the letter K. Yes, the same letter, which can be confusing. Potassium is an electrolyte that's crucial for many bodily functions, including maintaining fluid balance, nerve signaling, and muscle contractions, including the beating of our heart. So, while both vitamin K and potassium are essential for human survival, they are completely different substances with different roles in the body. All right. I hope this has answered your questions about vitamin K and its important role in our health. If you found this video helpful, please give it a thumbs up. It really helps others find this information. Don't forget to subscribe to this channel and turn on the notifications so you'll be alerted when I post new videos on various health topics. You can check out my next video right here. Point to on-screen suggestion. I hope you enjoy it. Thank you so much for watching, and I hope you have a healthy day. Goodbye for now.